What is CBAVD, and how does it relate to cystic fibrosis? Imagine a man trying to start a family but facing unexpected challenges. One reason might be a condition called congenital bilateral absence of the vas deferens, or CBAVD. This condition means both tubes that carry sperm from the testes to the urethra are missing from birth. Without these tubes, sperm can't reach the semen, leading to male infertility. CBAVD affects about 1 to 2% of men who have fertility issues and is found in nearly 95 to 98% of men with cystic fibrosis. This strong link makes CBAVD a common reproductive system feature of cystic fibrosis. CBAVD is closely tied to mutations in the cystic fibrosis transmembrane conductance regulator gene, or CFTR gene. This gene produces a protein that acts as a channel for chloride ions on the surface of cells. These channels help regulate salt and water movement in tissues like the lungs, pancreas, and reproductive organs. When the CFTR gene has mutations, its function is disrupted. This leads to the thick, sticky mucus characteristic of cystic fibrosis and can also interfere with the development of the male reproductive tract. In men with cystic fibrosis, CBAVD occurs because defective CFTR protein affects embryonic development. During early stages, the vas deferens may not form properly, resulting in their absence. Interestingly, many men with CBAVD do not show the typical lung or digestive symptoms of cystic fibrosis. Studies show that between 60 and 97% of men with isolated CBAVD carry mutations in the CFTR gene, often with one severe mutation and one mild mutation. This suggests that CBAVD can be seen as a genital form or an atypical version of cystic fibrosis. Diagnosing CBAVD involves a physical exam to check for the absence of the vas deferens. Ultrasound scans of the scrotum and rectum help confirm whether the tubes are missing. Genetic testing for CFTR mutations is also important. Semen analysis usually shows no sperm, low semen volume, and an acidic pH because the seminal vesicles, which produce fluid, are often absent or underdeveloped. From the perspective of cystic fibrosis, CBAVD highlights how this genetic disorder impacts more than just the lungs and digestive system. It also affects reproductive organs, especially in males. Almost all men with cystic fibrosis are infertile because of CBAVD, emphasizing the role of CFTR mutations in reproductive development. Understanding this connection is vital for genetic counseling and planning appropriate treatment options. In summary, CBAVD is a congenital absence of the vas deferens that causes male infertility. It is strongly linked to cystic fibrosis because both conditions involve mutations in the CFTR gene. CBAVD can occur as part of classic cystic fibrosis or as an isolated reproductive issue associated with CFTR mutations. Recognizing this relationship helps healthcare providers guide diagnosis, counseling, and management for men affected by either condition. If you or someone you know faces reproductive challenges, consulting a healthcare professional is always the best step to explore testing and personalized options.